So today's topic is drug take-back programs during the pandemic. So during our call today, Jody Miller from Indiana Addictions Issues Coalition will be monitoring our chat box. And then if you have any questions about the Indiana Coalition Network website or getting on board, again, we are here to help you through that process. So our primary speaker today is going to be Kimbra OBrien, and we are super excited that she's going to share with us some things that they're doing up in her county, up in Jay County. So the National Prescription Drug Take Back Day addresses a crucial public safety and public health issue. And according to a 2018 survey, 9.9 million Americans misuse controlled prescription drugs. And many of those came from family and friends, even from the home medicine cabinet. So we know that this work of the drug take-back events is critical to prevent drug addictions and overdose deaths. How do we do that in the time of pandemic? That's what we're here to talk about. So our objectives today, again, understanding what those drug take-back days are, how to engage your local network of people for support to get those events going, and including finding permanent homes or locating ones that are already established for those 24/7 drop boxes, networking among our LCCs to talk about events and activities that are, or issues that are happening in your area, and then identifying how the Indiana Coalition Network can assist your LCC. And as always, we're looking for webinar topics. So if there's something that's important to you and you want to talk about it on this monthly webinar, just let us know and we'll work through that. So Kimbra OBrien is the Executive Director of Jay County Drug Prevention Coalition. She's a licensed clinical addictions counselor and certified peer addiction recovery coach. She holds an MBA specializing in healthcare. Kimbra has 31 years of successful coalition building, addictions intervention, and prevention experience. She is responsible for the oversight of Jay County's first drug-free communities federal grant, Northeast Indiana Recovery Network Anchor Hub, Indiana Department of Health ECHO grant, including Jay County's Overdose Fatality Review Committee, DMHA Northern Indiana Evidence-Based School Prevention Grant for Jay County Schools, and Tobacco Prevention Cessation Capacity Grant. Kimbra is the past executive director of Caring About People, a nonprofit organization that provided prevention and counseling services to over 700 families annually in Allen County. So you can see she's a highly qualified and very busy woman, and we're so grateful that she's able to take time to share with us things that are happening up in Jay County. So if I can turn this over to you, Kimbra, that would be great.
So I first want to thank the organization for allowing me to present today, as well as all of you taking time out of your busy schedules to join us for this hour. Very excited to be able to do this and share what we're doing here in Jay County. Our small little community, we have been very, very busy over the last couple years with our Drug-Free Communities Grant, which has opened up various doors for us to be able to collaborate more in our community and on out to other surrounding counties in our area. So very thankful for that. One of the things that we were concerned about is whether we were going to be able to have our drug take back time during this situation, and as of right now, we are still on for next month, October 17th. So we do this in a lot of collaboration with other community partners. So let's go on to the next slide. So our coalition has been doing this Fall Talks Away Day for several years now in collaboration with the Jay County Solid Waste Management District. It's once a year. It's fall. It's time to just get rid of a lot of things. We have it at the high school, and it pulls a lot of our community partners together. This is our 17th our 19th annual Take Back Day, rain or shine. So it is for Jay County residents only. So collaboration is the key to make this happen. So, next slide. So one of the things that we're very proud of is we are that very first stop when individuals pull into that back parking lot. They've come in one drive and they are looped around to our very first stop. So we actually get to monitor where people go from that point. So we have to have a conversation with everyone that comes. And the year prior, we had over 350 cars come through. Now that's may not sound huge to some of the individuals that are in larger counties, but our population is 20,000 in our whole county. So we are talking to a lot of different individuals that we wouldn't normally talk to. They range from individuals with children, individuals that are grandparents, to people that don't have children. So it's a wide variety and a huge population for our community that comes out. We utilize this as a prevention effort and outreach. So we ask everybody that comes at that first stop and say, okay, we have a questionnaire for you. Do you have children in your home? If you do, how many children do you have? And then we also ask them, if you don't have children in your home, do you have children that come to your home? Let's say you're a grandparent or an aunt or an uncle or just a great neighbor that allows the neighbor kids to come over, or you are a mentor. So you have individuals that come into your home. And then that's a way to give them information about different programming, different things going on in the community. We also ask them if they are going to be dispensing them any medication. So then we know that medication is leaving that home and is getting disposed of properly. So that's how we use it as a prevention and outreach effort, as well as an engagement effort. And next slide. So we have to do this in conjunction with local law enforcement. And our Jay County Sheriff's Department, they provide a local law enforcement person that's there from 7:30 until we wrap up about 1:30. That law enforcement partner has to be there the entire time. So that gives us a lot of chances to network and have communications with them and what's going on in our community. And that is huge. Then secondly, other law enforcement agencies or organizations throughout Jay County come to dispose of medications, dispose of, they have their own drop boxes, secure drop boxes in their facilities where individuals come in and get rid of medications, over-the-counter prescription, over-the-counter as well as prescription medication. So they'll come by and drop things off too. Up until this past year, this was the only time sharps could be disposed of safely in our county. So that was huge. So we would have a lot of sharps disposed of as for the law enforcement organizations where people would just have needles and didn't know what to do with them, or they found needles, or the police found needles. And so this was a way for them to dispose of that. Now, when I say throughout the county, we have smaller communities that have town marshals. And these town marshals don't necessarily have access to dispose of things or know what to do. So this gives us a chance to have conversations with them about, okay, what's going on in your community that has a population of 3,000? And then that again gets us to be able to go out into those smaller communities. The other partnership that handles all of this with the Solid Waste District is the New Genesis Corporation, and they actually organize all of this throughout the state with solid waste districts. You can call them up. You can do a take back day on your own, but it's about $1,500. Now, I don't know about you, that's quite a large part of a budget. So that's why we do it in collaboration with our solid waste district, our police department. There is also Boy Scouts are out there, they're taking back the tires, and other organizations are out there. But Nugenis, they bring people in, set everything up for you. We show up. They then take everything and dispose of it for us. So it is just a fantastic way to work and partner with them, and they're great to work with. And they work hand in hand, again, with not only our solid waste district, but all solid waste districts across the state of Indiana. This year, because of the pandemic, our solid waste district is going to allow us to pull in other community partners. So like I said, we are in that first stop. So our community partners that are part of our LCC will be coming in, and so Meridian Health Service, our local Children's Bureau, the System of Care Partners, different prevention organizations and recovery organizations across the state, across our county will be there. They have put together over 200 bags of resources and tools for families and adults, grandparents, to kind of look at to see what is available in their community and in their county. We also will have either our community nurse from the health department or a pharmacist or a pharmacy tech available to help us identify medications, because you have to separate out your controlled substances and your non-controlled substances. They dispose of them differently. So that's why we also have our health department is involved last year. They hope to be involved again this year. And if they're not available, then we're going to be working with a local pharmacist they're volunteering their time to be out there. So that is huge. These are all of the individuals that are involved in the disposal process. So our solid waste management district, they take the products and set everything up for us. With Nugenis. Nugenis takes these items and they separate out the controlled substances and the non-controlled substances and the sharps. So there's basically 3 different big bins that we are throwing medications in. Our sheriff's department is there monitoring. And then, and I know I'm going to butcher this name, Convanta, they literally are the incinerating facility down in Indianapolis. They have 3 across from Indiana out to the east. But what they do is then they incinerate the products and use it back for energy. Nugenis and or the sheriff's department must take the products there under a controlled environment so that they are sealed, protected, and there's no chance of those drugs getting back out on the streets. So that's huge to understand that there is all these checks in place, that it's not just, okay, I'm going to take all this back and hold on to it. There is a clear chain of command that is followed. So that is huge. So the Jay County Drug Prevention Coalition plays a big key in this in regards to making sure that we get these drugs off the street. Since we've started this with our Drug Free Communities grant, for the past 2 years, we have added 2 more drop boxes in our county. One is at the hospital and one is at Walgreens. We've worked partnering with them to get those established. After the first of the year, the health department has been able to get syringe drop boxes, secured places for syringes to be dumped. Now, many people in the community would be like, oh, well, you know, nobody's going to drop their syringes off. So they had them installed, I believe he said in March or April, and he's had to dump them twice already because they were overflowing. So those are huge. Our community is not on board with having a needle exchange program, but at least we're getting the needles off the street, in our opinion. We also really play to the farmers. A lot of farmers have vet meds and things like that and needles. So we played to them about getting rid of those during that time. We've compiled a list. Our task force has compiled a list of take-back locations throughout Indiana. Oh, I'm sorry, this is different. We also have a list that we hand to everybody that comes that day that has a list of where all the drop boxes are, where the needle drop boxes are, 24 hours, and as well as what is available in their other hours. You can go onto the state Drug Abuse Prevention Task Force. They have compiled a list of permanent take-back locations throughout the state of Indiana too. So if you're wondering in your community where you might go or a surrounding community, you can go onto their website and look at that. Now, I did notice when I was looking at that, ours was not updated, so that's something we will definitely want to do with them, but there are take-back locations listed with the state of Indiana. And that is, oh, another thing is you don't get out of your car to do any of this. New Genesis and us and the Boy Scouts, we literally, okay, where's your stuff? Hand it to us. If they've got tires in the trunk, the Boy Scouts literally go in there, lift the tires out for them. If you've got other toxic stuff, New Genesis, their employees unload it. So there's not any, there's that chance, a low risk, a chance of contamination. So that is one of the reasons why we believe that this will happen during our pandemic. We, of course, you know, things could change, but we will all be wearing our face masks. We'll be doing everything that the health department tells us we need to do. So that's why we believe that this will be very successful again this year.
Awesome.
Any questions?
Make sure you unmute yourself if you have one. And while you are thinking of your questions, I would be so appreciative if Donna Downs could unmute herself and tell me which county she's from. She's the only one I don't have a county on.
Donna Downs just unmuted. I also just sent a text. I'm with Grant County. I'm a professor at Taylor University, and we are working with Pam Leslie from Marion General Hospital to do a public relations campaign regarding the opioid epidemic in Grant County. And as a part of that, we'll be planning a drug take-back day.
Great.
Donna, thank you so much. I have your county down that you're now with. And my son is at Taylor University.
Oh,
so
cool.
Small world.
Yes.
Okay. Kimbra, can you talk about some of the marketing that you've done that seems to work well, whether it's social media, radio, and those kinds of things, just getting that word out?
Mm-hmm. Yeah. So with our community, we have one radio station and we have one newspaper that I will say the more of the older population really still love getting that newspaper. So there's usually big information in the newspaper. The radio publicizes it. Our solid waste district is also affiliated with our Portland, Indiana, which is our county seat. So then our city also publicizes it through their own bills that they send out for trash collection and those kind of things. There is social media posts from us, from all of our community partners. It is pretty much across every aspect through social media, radio, newspaper. Solid Waste District also has a billboard that they put up. As well as then the mailers that go out to community residents. And since this is our 19th annual and we were not able to have a fall Talks Away Day, which we do, or not a fall, a spring, where they just have like a free landfill day or free trash day. We don't participate in that, but so we do anticipate that there will be a much more individuals coming to this because of that.
And you had mentioned that you do a survey as you're the first point of contact for this event. So you do ask some questions, and later on when Lori speaks, we've actually put up the questionnaire that you use. So I'm curious what you use that collected information for in your LCC.
So what we utilize that for is to demonstrate the number of children that could be impacted, that are not being impacted by those drugs being taken off of the streets. This year we will also, Children's Bureau will be handing out drug lock boxes for those that have controlled substances in their home, and if they want to keep those. So that is huge for them, that we are going to be able to provide lock boxes to individuals that have controlled substances for families. We then also utilize it for networking, because we have names and numbers, and if they'll share that, we can invite them to the coalition to get our newsletter or to get information, connect them with resources, some of our programming. So those are different ways that we utilize that information.
Thank you. Before we move on, is there anyone else who has a question? Okay, in just a bit, Lori will share what some of the other counties are doing. Scott, Franklin, Hamilton, what they're doing. So if there's something that's happening in your county that you want to share, definitely think through that. And then when Lori speaks, we'd love for you to share what you're doing. And Kimbra, cannot thank you enough for your presentation and sharing what you're doing. And it's definitely planted some seeds of some different ways that maybe we can do these collection points.
Thank you.
Okay, now we're going to turn this over to Allie. Laylee is the president and co-founder of Solutionize, who has pulled together this Indiana Coalition Network website for us, for our use. And she's really going to, share her screen and talk about some of these networking opportunities that we have as LCCs and members.
Thanks, everyone. Thanks, Bobby. Can you see my screen?
Yes.
Okay, so I would guess that all of you are already onboarded and have your member account on the Indiana Coalition Network.org site. So, and for those of you who don't have an account yet, you may want to check with your LCC coordinator, and because she can add you, or you can request us through them to add you to the site, because what happens is they will add you to their account, to the county account. So what you're seeing right now is a member who has, after you log in, this is what you're going to see. So just a brief thing, this would be information on your organization, your coalition. But what I want to highlight here is this section where my mouse pointer is, which is called My Activities. This is where the action happens among the coalition members and the community members. First is, well, we have the information exchange, which is, we can share information, and I can show you that. Oh, God. I didn't realize that I was, okay, here it is. So this is the information exchange. Assets are, the resources are listed chronologically based on when they were added, and if there are information resources that you want to share, please let us know. Let Bobby know so she can send you the instructions, and then or send an email to info@indianacoalitionnetwork.org. You can search the information exchange by document type and by categories. But also there you can also search by keyword, and let's do that. We have recently added a few items here about the take back, which is drug take back, which is our topic for today. And so with that, we have all these wonderful resources that our members have shared. Kimbra has shared a couple of her flyers and the questionnaire. I mean, and this is free for you to access, to get ideas from, and and if there are now this is for you to read and share. Now, when we have these, excuse me, so we have all these resources that we say, it's good, but that's passive because we just read it. We may want to contact Kimbra or contact the rest of the community about, say, drug take back. This is where you go to the conversations. We post a conversation, like Bobby here posted something about IntelliGrant. This was like 2 weeks ago. However, you can also, when you respond to it, it gets moved up. So this is where the conversations happened. These are conversations that are for the whole community, and they are we have categorized them. We have grouped them by categories. So the hope is we're going to have a lot of these, and it will help us, sort through them by clicking on the categories. And so if we want all conversations about coalition management, then we can just sort them, search for them, and have them all in one place. We have, and then we do for the conversations, you can reply. You can always reply to conversations, and then that's where it happens. That's where the magic happens. If you posted a conversation and somebody replied to it, the original poster gets notification that somebody has replied to their conversation. So this is for the whole community. Now, there's another tool that we want to get you to. I think this is going to be very useful for the whole group. This is, from the survey that we had before at the start of building, when we started building the network, there were questions and there were comments about collaboration, that it would be great for, the different members of coalitions to collaborate with, among the different coalitions, not just within each one. So that's why we started with the groups. We have here open groups, which is recovery programs and job postings. This is where, and it's easy to be a member of the group. If you find a group that you want to join, just click on it to view, see what's happening, and then it's as simple as joining the group. And if I click on join the group, because this is an open group, so now I already have joined it. There are also other groups. There's another category for groups, which is the restricted. What this is, you know, some groups, some organizations or groups are like the regional groups. You know, it's for a select group of participants, because this is like contextual, topical, geographic. So like Fountain County, I didn't realize this. So Fountain County has started their group. Oops. See, this is the difference between the public group and the private group. I click on the group, I can open it, but because I'm not a member, only the members see what's happening here. And for anyone to join the group, they have, if I click on this, it will say your membership request was submitted. So whoever is the group contact will be notified that I am requesting to join the group. And if they think that, you know, they vet the members and, you know, if they think I'm worthy, then they will accept my request, and then I will be notified. Then I can participate. I see what's happening. So let's go to the open groups, because I wanted to show. I think we did this tour before, but now I think it's more relevant because now we're all members. So in the groups, we also have the conversations. This is, however, just conversations among members of the group, as opposed to our other conversations that's like everybody in the community. So the groups is good for like ongoing work groups, committees. You have the one place to go. Your conversations, your discussions and resources don't get, you know, mixed up with all your emails and chats and Facebook and text messages. So if you're working on, if there's an ongoing collaboration with a small group, use the groups function, and then there's one place to go for all that assets. You can also upload resources. The members of the group can upload resources, and it's simple. Just choose the file, and then you just, you know, put the necessary like information on the title and stuff like that. And there's also, yay, nice photos. Okay, there's also the members. This is another way to communicate with the members directly. This is the one-to-one. It's similar to the Member Connect on the broader group, site, but this one is getting in touch with the people within your group. It's a direct. The messages that are sent here are, it's like the direct message. The group doesn't see it. So if, you know, sometimes you need offline conversations, this is where you want to go. Okay. Oh, now, are there any questions? Please feel free to interrupt me. Now we have I mean, it's simple to use, and I I believe, I mean, from my experience, it's very useful for collaboration, for work groups, and just, to keep going in between, like the face-to-face. And now we barely have face-to-face. So this is a way to keep discussions about certain, subjects or work items in one place. And then to start a group is simple. Just log in, go to start a group, simple as group name, and whether it's open or restricted. If it's, if it's open to everybody, just make it open. Or sometimes you want to restrict it and open it later. You can do that too. And then the objective, this is where you state the objective, describe the group, and say who should join, submit it. We will get a notification. The site management community management will get a notification, and then we'll approve it, and off you go. You can start using your group. You may want to send communication to your members to let them know that the group is there and they can join. But also, this is also where you use the conversations in the broader community to say, hey, we have just established a group like this thing where we said groups have been created. It's letting everybody know that it's happening. So I think I think I have given you the base information and detail, and let me know if you have any questions, or if you need, if after this something pops up, some question, something that's not clear, please feel free to send us an email at info@indianacoalitionnetwork.org.
All
Thank you
right.
so much, Allie. That's definitely helpful. I think on that website, the best thing to do is just log in and start clicking around to see what you can find. And if you're stumped, then just give us a call or send us an email and we'll help you. So at this time, we'd like to turn the meeting over to Lori Crosdell, CEAS of Scott County Local Coordinating Council Coordinator and Drug-Free Communities Coordinator, to talk more about the Drug Take Back Day events from other counties, and then looking ahead to what's happening next.
So yeah, I'm just going to mention, here's Jay County's questionnaire, I guess, right?
Yes.
And their Talks Away Day advertisement. And these are just some great examples, of what other communities are doing. And this is the questionnaire. I love that. So do you have them fill that out while they're there, Kimbra?
Yeah, so what we do is, so our volunteers from the LCC, we have a clipboard, and we just literally walk up to their car and ask them these questions. And then if they do want to provide their name, and we tell them, you don't have to, we won't sell your name or number or anything like that. But if you want any more information about the coalition and our network and what we do in the community, please provide it. So it's kind of a good way to let them know who we are and what we're doing in the community, and let them know that the LCC is open to anybody. So yeah, we just walk up as they're waiting in line, which is kind of good for us.
Yeah. Okay, awesome. So go to the next slide. And so here's some examples. The first example is a drug take back flyer from Hamilton County. And what I really like about this one is the icons at the top. Follow these 3 steps: collect, attend, and drop off. It's a little small. Collect. Can you read those for me, Bobby?
Yep. So number 1, collect your expired and unwanted prescription drugs and medications. Number 2, attend. Bring your prescription drugs and medications to the event. And 3, drop off. Members from the Indiana Attorney General's office will collect your prescription drugs.
So, I love those three things. It gets people a visual. And then also, of course, they have the logo for Kroger. It's always important to put the location, the address, the date, the time. And then, of course, the sponsors on there. And then the one on the far right is Franklin County's LCC advertisement for the Staying Alive LCC Coalition. So again, just some great ideas. And then the one in the middle is Scott County's. Now, we have not made up our October 24th DEA drug take back flyer. We'll be working on that in the next couple days. But this is an advertisement for our 2 drug drop bins that are permanently located in both the Austin Police Department lobby as well as the Scott County Sheriff's Department lobby. One thing that I have found especially useful if you do not know how to develop a flyer is that the DEA website has some templates. A lot of them look like that one little page, that one little square in the middle flyer, "Don't be the dealer." I'm not really sure I like their language, but that's the template that they provide, and you can make it your own with your date and your location and your time, which is usually, what we have done in the past. But, and I would recommend that if you haven't already gotten an account on Canva, Canva is an amazing site in which you can make flyers like these on your own. You don't have to be a person that has a background in graphic artistry. You can get on there, you can make your own flyers, and you can put your own information and your own photos on there as well. So there's a place, if you want to have access to these flyers, it tells you at the bottom of that, you can take a screenshot, or we'll be getting these PowerPoint slides out, but it tells you exactly the prompts to go through to get to these actual flyers, and you can even download them yourself. So next. So we wanted to, ask you a question. I guess these are just some examples of things going on in the area, but we also want to know what's happening in your area. So this is going on, a recovery, a day of healing, September 26th from 10 to 5 at the Indiana State Museum. They're partnering with the Office of the Attorney General. Oops, where'd it go?
Sorry about that, Lori.
It's okay. And they're doing a drug take back, and they're also doing naloxone training. And so this is an exciting event that's coming up. And if you go to the next one, I'm especially excited about the next slide because I think I did not even know this was going on. Some of you probably did, but they've extended this exhibit at the Indiana State Museum. It's going on through February 7th of next year. But it's an exhibit that talks about the science and the biology behind opioid use disorder, our nation's history with the health crisis, personal stories from Hoosiers that have been impacted, which I love, and various roads to recovery. So they've used art, science, multimedia, hands-on interactives, and inspiring artwork to help us understand the nature of addiction, how we got here, and what we can do to change the course. So I've actually sent this to our Empower Youth Coalition coordinator and told her that I think this would be a great place to take some of our youth on a field trip. So hopefully, you can check that out as well. And then is there anything else? Oh, before I go to the rest of you, and if you have any exciting events coming up, I wanted to mention that on October 22nd, which is our next Indiana Coalition Network webinar, we are having 2 amazing guests that we are blessed to have. First of all, Ann Hazlett, who is now working for Purdue University as in their government relations. She just came from the White House Office of National Drug Control Policy. She was their senior advisor on rural affairs and one of the people who worked on the rural community toolbox. So she will be on and introducing to us Betty Ann Bryce, who's now working in rural affairs, also at the White House ONDCP, and she will be telling us all about the Rural Community Toolbox. Hopefully you've heard the podcast that Dawn Pelk did with Ann Hazlett. And so we thought that was such a great idea that we decided that we would like to feature this in our next webinar. So Betty Ann will be on the call and sharing that with us. And we know a lot of us live in rural areas of the state. So this tool will be an exceptional thing to add to our toolbox in helping our communities. So we hope you will plan to attend that. Again, that's October 22nd from 12 to 1. And then we also wanted to ask, this is what we call the minute around the Zoom. If anybody would just like to unmute yourself and share about any exciting events that you have coming up. While you're thinking, Fayette County is doing a drug take back at the Gleaners Senior Food Distribution next month. And it's going to be a drive-through as well before the food pickup. And they usually have 500 vehicles. Gleaner uses an old Kmart parking lot for the distribution. That is outstanding. Just to give you an idea, we do our DEA drug take back in Scott County. We used to do it at the Sheriff's Department and in Austin, and we hardly had any people come. So we changed it to the Scottsburg Walmart, which is where just about everybody goes on Saturdays. And we have found that we've had a lot better, turnout for that. If you look in the chat box, it looks like Wayne County, Megan Broker has shared a document about, I'm assuming it's their DEA drug take back.
Yeah, it's their flyer.
Oh, nice. Okay, yeah.
We'll be uploading it to the information exchange for all of you to see, and you know, it's something that I always say, if it's a good idea, we can always steal it.
Yes. Well, and you know, just going back to that one that one flyer that was at Hamilton County did, I actually like theirs a lot better than ours. So I may be stealing some of their ideas. I think that we would all agree that in what we do, it's okay to borrow from each other.
Mm-hmm.
So yeah, I love that. When I saw the Hamilton counties, I just thought, I like it a lot better than the national DEA one. So I just don't like the don't be the dealer. I feel like we need to keep it positive. And I just like their, you know, I think I'm a visual person, so I not only like to have the content, but I like to have a visual to relate to the content. So that works really well for me. So good job, Hamilton County. Monica Greer is her name. So good job on that. So anybody else have anything that they want to share? I feel like there was something coming up. Was it Ripley County? Is anybody from Ripley or Batesville? They had a really cool event coming up, but hopefully we'll get Ripley onboarded and we'll have them share their flyer on there about that great event coming up. Anyone else have anything they want to share?
Jay County, we would like to share that we are going to be doing a Zoom craft, C-R-A-F-T. That's the Family Support Group Facilitator Program. We are going to be doing it Zoom. Us and Brown is Hope, who is, they have like 70 locations throughout the state and on into Ohio. So it's basically a community reinforcement and family training. So it's for families or individuals that have loved ones that are struggling with addiction. So it's a 12-week Zoom program, and we're only having 12 individuals sign up for it, so we can make sure that it's very intimate and that those individuals that need that information have that time to share. It's on a Wednesday evening from 6:30 to 8 p.m. They would just need to, I can send the flyer in to you guys so that it can get posted for those families that have loved ones that are struggling and need some support.
Thanks, Kimbra. Well, our Thrive Recovery Community Organization has been trying to get that going here, and of course, with COVID, it kind of cut into that. So I really like the idea of you guys doing it on Zoom. So I'll mention that to him.
Yeah, and we actually have one individual that signed up from down in Bloomington area. So we're hoping that it'll be a cross sector of anybody from across the state of Indiana.
Nice.
So hopefully we won't feel alone.
Yeah. So you still have openings then for people to be a part of it?
Yes. Yeah,
Okay.
we do have some openings. We are going to be closing the group once we get to that 12, and we plan on starting October 7th.
Great. Thank you.
Mm-hmm.
Anyone else?
In Wayne County, we have during this time, we actually had a free online naloxone training today. And then we also have another one scheduled for Monday, September 28th from 5 to 6 p.m. And I can share that link in the chat box if you guys would like it. It's a partnership with IU Center for Rural Engagement. We actually had one on Overdose Awareness Day, and I attended that one. And it was very short and sweet and informative. And once you complete this training, which took maybe 20 minutes, but they have carved out an hour just in case there's a lot more questions. But you just fill out a short survey, and then you are able to choose to get 2 naloxone sent to you. And I got my naloxone sent to me the next day. So it's a great opportunity. It's free. It's for anybody to attend, and it's via Zoom.
Nice. Very cool. Yeah. And I don't know if this is something, I know our Scott County Health Department, like I can just walk in and ask for several doses of naloxone to carry with me in my purse. Hopefully your health departments are also doing that. If not, I would encourage them to get in touch with, email me. I'll put my email in there, and I'll have you email our Scott County administrator to see how maybe your health department in your county can coordinate with them and find out how they went about doing that. So, anything else?
Lori, I wanted to mention that the Indiana Recovery Network .org, they've got a website, and they also have monthly webinars that are, again, focused about the recovery, and that we kind of kicked off our program through them. And so they've got the recovery hubs, and they've got a lot of exciting things that are happening there. So I just wanted to put a plug in for them.
Awesome. Yes, we appreciate Heather Rodriguez and the great work that they're doing. Hey, well, is this me, or am I turning
This
it
is
over?
you get to
Oh,
you
this
get to
me.
finish this out.
Okay, awesome. So this is a list of all the counties that have onboarded, and I know that you know, you are key people that if your county has not yet, that you can have a conversation, or maybe you even know a neighboring county that you are familiar with their LCC coordinator, and you could have a conversation with them to encourage them to be a part of this. You know, interestingly, I am on several other LCC counties email distribution lists. So I got an email the other day from Ripley County. Well, I responded back and said, oh, this is a great flyer. This is a great event. How about you know, make sure that this gets sent to the Indiana Coalition Network and, it, you know, gets posted so that other communities know about the great work you're doing. Well, she didn't know what in the world I was talking about. Well, I just assumed she was Ripley County's LCC coordinator. So she's going to get in touch with her LCC. And then we're going to hopefully eventually in the next couple weeks get Ripley County onboarded. But these are the counties, so we hope that you will, I'm assuming, are these in order of regions?
Alphabetical order.
Alphabetical. Okay, so I know my region is Region 6, and we are not all onboarded yet, but I'm working on it. So we hope you will join your regions group on the ICN website. And then we hope you will also get on there and share some of the great resources that you guys, you know, have, because that's how we all learn from each other. I learned some amazing things today from Kimbra. You know, we've been doing drug takebacks for years. And I learned some great things today from Kimbra that I have never done that we're going to incorporate into our drug takeback days. So thank you so much, Kimbra, for sharing with us. Okay, is that the last one?
Just if you have questions, get a hold of us. We're here to help.
Yes. So on that last slide, go back one. Sorry, I didn't mention it. There is, so that's how you, if you have not, or if your LCC has not, or a neighboring LCC is not onboarded, you can just have your LCC coordinator reach out to Bobby Foster. There's her email address right there. Or they can also email info@indianacoalitionnetwork.org. So we're hoping to get people onboarded as soon as possible, because
Lori, I wanted to interrupt you there. In addition to the emails on the site, if you click on the Contact Us tab, that's another way to send us a message, so you don't have to worry about which email to send to. Just fill in that form and we will get it.
so we just want to thank you all for being a part of the webinar this afternoon, and we hope you all will have a great week and weekend, and let's stay in touch, because this is how we get better in our communities at what we're doing. So thank you all. It was great to see you.
Thank you.
Thank you.
Thanks, everyone.
Thank you.